السلام عليكم ورحمة الله وبركاته. معكم اسماء المطيري من دفعة 222. حتكلم اليوم عن محاضرة Burnout الدكتور أمان الله. نبدأ بintroduction. Burnout عبارة عن syndrome. معناتها إن لها مجموعة من symptoms seeing in demanding jobs such as social workers, teachers, healthcare professionals, especially when we talk about physicians or doctors. They feel overwhelmed or engulfed by their demanding jobs, and they are unable to meet their constant demands as well. Burnout عبارة عن state of emotional, first, mental and physical exhaustion. لما يكون عندك exhaustion بالثلاثة parts هذه emotional و mental و physical معناتها عندك burnout. طبعا هو caused by excessive and prolonged stress. لما يكون عندك chronic stress that is not managed well or successfully, that would lead to burnout. طبعا burnout is well defined by someone called Beck. Beck defined the burnout as syndrome made up of 3 dimensions. أول شيء emotional exhaustion, depersonalization, and a personal accomplishment or reduced personal accomplishments. ال 3 dimensions هذه مرة مهمة بنتكلم عنها in depth بالسلايد الجاية. Okay, moving on to the definition of burnout by WHO. عبارة عن syndrome conceptualized as a resulting of chronic workplace stress that has not been successfully managed. As we have mentioned already in the burnout عبارة عن chronic stress, we have not managed it successfully, that would lead to burnout. طبعا burnout was not included in the previous international classification. However, in the 11th revision of international classification of disease, طبعا بال 11th revision of the international classification of disease, it's been categorized as an occupational phenomena that is not classified as medical condition. So meaning it's related to the workplace mostly, meaning in a lot of not one person, it's not an individual problem. A lot of people at the same workplace would feel it. It's not classified as a medical condition, meaning we cannot really diagnose it by diagnostic tools, and we cannot treat it by medications. So moving on to the subtypes, we have 5 subtypes, which are the frenetic, under challenge, burnout, existential, and crisis driven. We're going to talk about them one by one now. frenetic subtype. هالسبتايب characterized بأن الشخص يكون super ambitious, يعني مرة perfectionist. هالشي بيخليه إنه overwork him or herself. بيكون إنه لما يكون عنده هالtendencies بيخليه هالشي إنه يهمل الجانب الشخصي والجانب الاجتماعي regarding the relationships. They would feel the urgency to accomplish their goals and experience high level of stress and exhaustion. As we have mentioned, they want to accomplish a lot, which is sometimes is not really healthy. That would lead them to burnout. And their challenge عبارة عن in the workplace or the person who experienced this subtype, they would feel like their work is not really challenging enough. They feel bored. They feel like they are disengaged from their work as well. Let's take an example. Someone is working in a project in their workplace for a really long time, really long years. They would feel that they're not really engaged in their job anymore. Individuals with under challenge burnout may feel unfulfilled. They struggle to find the meaning of their work. The third subtype, burnout, from its meaning, it means that their work is really demanding. They feel physical and emotional exhaustion. Let's take an example. For example, during the pandemic or COVID-19, a nurse is working for really long hours, during this pandemic. She feels now her job is really demanding because of the long hours. They feel exhausted, lack of energy, and like they're not really engaged in their work as well. Moving on to the first type, or existential burnout, people who experience this subtype, they would feel that their job is not meaningless. They're not feeling like they're not finding the job, the meaning of their job. They start feeling disillusionment, meaning إن مثلا يكونوا متوقعين شيء معين وهالشيء ما يكون إن ما يلقون هالشيء المتوقع. They start like feeling disappointment regarding their job. They start questioning the purpose of their work, feel sense of emptiness and disconnection. The fifth and final subtype, which is crisis driven from what indicates it's a sudden and traumatic events. فهالشيء لما يكون عندي مثلا تدلي عندي traumatic event or trauma، هالشيء بيخليني أتعرض ل high level of stress، بيكون مثلا which lead to burnout obviously, such as natural disaster, personal illnesses, traumatic events. They start feeling anxiety, depression, and post-traumatic stress disorder. So as a quick comparison, frenetic subtype, they're perfectionists. They want everything to be 100% accurate, leading them to undergo burnout. So the second type, which is under challenge, their job is not challenging enough. Okay, burnout, high demanding jobs, demands. Existential, meaning they start questioning the meaning of their job. They're thinking their job is not meaningful. The final type, which is crisis, meaning trauma. They undergo trauma or experience trauma leading to burnout. هنتكلم الآن عن signs and symptoms. عندي physical signs and symptoms، في emotional، في برضو behavioral. physical as it indicates مثلا في بيكون headaches، في back pain، في muscle aches، في lowered immunity، feeling sick، في loss of appetite and sleep habits as well. Moving on to the emotional, they feel like they're failures, feel helpless, defeated, detachment, feeling alone, loss of motivation as well. The other behavioral signs and symptoms, they start withdrawing from their responsibilities. ما يبغون يكونوا responsible. They start isolating themselves from others, using foods, drugs, alcohol to cope with the illness or with the burnout, taking out your frustration on others. They start isolating themselves or they start treating others badly. The causes of burnout, also 3 dimensions: work-related, personality traits, and lifestyle. Starting with the work-related, as it indicates, it's related to the workplace. They feel like they're not having enough control in their workplace. They do not feel recognized or rewarded. They feel like they are not appreciated enough in their work. They feel like their job is really demanding and have high demanding expectations. They work under pressure, or high pressure, of course. The other cause, which is the personality trait, they're perfectionists, as we have mentioned previously. They want everything to be 100%, which is not really healthy. Pessimistic view, they have negative view regarding themselves and the world. Okay. Also, they need to be in control. They starting reluctance to delegate to others, meaning they think that they are the ones or the only ones that they do the job. But they're not really asking for help from others. Lifestyle related causes, they have working too much. They do not have time enough to relax and socialize. They lack support. They're not asking for help, or الآن بنتكلم عن dimensions and components of burnout. تذكروا لما تكلمنا عن 3 dimensions موجودة في definition. الحين بنتكلم عنهم in depth. تكلمنا بداية عن emotional exhaustion، عن depersonalization، برضو عن lack of personal accomplishments. So what do you mean by emotional exhaustion? They, due to the prolonged exposure to stress, they start losing enthusiasm. They feel trapped. They feel helpless, like regarding their emotions. They're mostly negative. Depersonalization. They start like treating people indifferently. They start treating them like as an object. They show negative attitude toward them. It's mostly regarding depersonalization, the attitude toward the others. لما نتكلم عن lack of accomplishment, يعني they start withdrawing from their responsibilities. They start detachment from their job. لما نتكلم عن lack of accomplishment, هالشيء علاقة بالجوب mostly, إن يتهربون من المسؤوليات, يبدون يعني detaching from their job. So now we will talk about the stages of the burnouts. First of all, the first stage, يعني mild signs. They are episodic, meaning إن بشكل متقطع ما تكون مستمرة بالhealth stage of signs. بيكون في mental fatigue at the end day of the work day. بيكون يعني feel unappreciated في workplace. They will feel frustrated, tired, feel like physical aches, back pains, headaches, and so on. The second stage, it is like more constant, like longer lasting symptoms, like such as disillusionment for the job, invading feeling of boredom, apathy or frustration. They're losing interest in the job. They're like feeling like they are ruled by the schedule. They're not like in control regarding their job. Intermittent periods of physical or like psychological symptoms. For the final stage, the severe burnout, they entered the burnout stage when the chronic stress has been lifted and treated, and of course that would lead to burnout. بيكون في psychiatric and physical health disorders such as depression, myocardial infarction. طبعا إن outcomes بتكون expensive consequences. بيكون مثلا في divorce, في high job turnovers, they start replacing their job a lot, replacing their job or their working place, substance dependence, drugs, alcohol, and so on, shorter life expectancy. So regarding the danger zone, if you feel any of these symptoms, that means you might experience burnout. Such as every day, like you feel every day is a bad day, you feel exhausted, you might lose joy and interest in the work, you may feel overwhelmed by your responsibilities, like you start withdrawing from your responsibilities, like less patience, you're not patient enough anymore, hopeless, you're like losing hope in life. That means you need to recover yourself. So how to prevent burnout? First of all, you start the day with relaxing rituals such as salah, reciting Quran, adapted healthy eating and exercising, sleeping habits. Set boundaries, like you need to start saying no for the requests that are at the expense of yourself. And daily break from the technology, learn how to manage stress by using relaxing techniques, balance between professional and personal needs. This is like the key preventive way. So how to recover from burnout? We have like different strategies. First of all, slow down, okay? Change your attitude, give yourself time to reset, to reflect, and to heal. And the second strategy is to get support. Start talking to loved ones, start sharing your feelings. For the third stage, which is to re-evaluate your goals and priorities. Start thinking about your priority, like start to reprioritize your hopes and goals and dreams. Start rethinking about what really makes you happy and act accordingly. So dealing with the burnout, we deal with the burnout with the 3 R's. First of all, recognize, watch the warning signs or the warning sign and symptoms of the burnout. Reverse, start undoing what damages your health and what causes you stress. And finally, resilience. Start building your resilience to stress. Try to find the ways that make you cope with the stress by taking care of yourself, your physical and emotional health as well. So let's compare between the stress and the burnout. So stress is actually over engagement. However, burnout is disengagement. Okay. Here is the emotions are overactive. Here are planted. يعني هنا بالستريس تكون الاموشنز مرة active، عكس البرناوت بتكون إنه خلاص انتهت. بخصوص third point, produce urgency and hyperactivity. However, here it would produce helplessness and hopelessness. And finally, or not finally, sorry, fourth point, energy, loss of energy. Here بتكون loss of motivation and hope. Here بيكون إنه أوكي خلصنا الانرجي بس إنه عندنا hope and motivation, something like drive us to work. Here is the opposite, or the burnout. That's the opposite. It leads to anxiety disorders. However, it leads to detachment and depression. Here it's like the primary is like physical symptoms. Here like the primary damage is the emotional part. Can affect your health. It can affect your life because it makes your life seems worthless and it start losing the meaning of it. So now we'll move to the objective, which is a burnout among physicians or doctors. The doctors are at high risk of burnout because their environment is demanding. They work for long hours. They have high level of stress. Burnout can affect physicians mentally and physically, as well as their ability to provide quality to the patient. So when someone is experiencing burnout, it would affect their ability to provide enough care to the patients. Burnout is a common problem among physicians because up to 50% of physicians experience burnout at their career. So clinical significance of burnout, it increases the risk of medical errors. It affects 50% of physicians, as we have mentioned already. It results in lower quality of care for the patient, more medical errors, and overall worse outcomes that affect the medical care system. Physicians burnout double the risk of adverse patient safety incidents, meaning increased medical errors, and poorer overall quality of care and decreased patient satisfaction. Causes of physician burnout, top 3 contributors اللي هي increase working hours, increase administrative tasks, meaning they start feeling documents and stuff العمل المكتبي يكون أكتر في documentation يعني كثير. Increase electronic medical related tasks in practice. They start مثلا entering data in the system. All of these would make the doctor feel that they're not giving enough care to the patient, leading to burnout. Symptoms among physicians, same. There would be emotional exhaustion, depersonalization, reduced sense of personal accomplishment, same as the previous ones. Okay, finally, strategies to decrease physicians burnout. Choosing physician incentives wisely. إن مثلا نعطيهم bonuses للدكاترة اللي مثلا prioritize themselves and self-care. targeting and addressing burnout in medical school. مثلا نضيف بالكريكولم يعني self training عشان إنه يعني self caring training. النقطة الثالثة إن fostering and prioritizing healthy work-life balance. مثلا نعطيهم balance schedule. Fourth point, involvement of leadership and administrators. مثلا بالadministrations مثلا بالhospital يسوون survey بخصوص هالنقطة عشان to monitor the burnout among physicians. Provision of resources for self-care and mental health services. نعطيهم مثلا therapy sessions. مثلا نسوي مكان لليوغا or meditation places for doctors at the workplace. Sixth, encouraging peer interaction out of work or out of work related tasks. طبعا وصلنا لنهاية المحاضرة. شكرا لاستماعكم. أتمنى أني غطيت كل حاجة. كل التوفيق لكم يا رب.